Now I am going to be turning it over to Erin Holbrook, who is a social worker at Cincinnati Children's Hospital, which has been in the network since the very beginning. I will ask her when she introduces herself, like Andrew, to share how long she's been a part of the network. But just by way of introduction, she is going to be taking us sort of to the next level. So Peter set the stage for how we work together. Andrew shared a little bit about the clinical framework, the clinical background for a lot of the different quality improvement activities that happen in the network. As the teams on the call know, when they're sitting down and thinking about what are some of the things that we need to improve, going and looking at the extent to which they're following those model care guidelines tends to be an important step in narrowing in on how they should focus their improvement work. So I think that was a very good overview of kind of the clinical basis of what teams are doing. What Erin's going to be focusing on is another part of this key driver diagram. You'll notice I keep coming back to this, which is really the picture of the things that we think need to happen to get more kids into remission. And Erin's talk is focused on some wonderful work that's been done at Cincinnati Children's that focus in on these key drivers around psychosocial health and optimal self-management and adherence. So Erin, I'm going to turn it over to you. I know you want to control your slides, so I'm going to click on a button that should let you do that. Let's see if this works. And let's just see if we can hear you.
Can you hear me?
We can hear you. Actually, I'm going to need the staff to make Erin an organizer. I can't give her the controls unless she's an organizer. That'll take us just 1 second. Erin, why don't you start your quick introduction while we do that?
Sure. So good afternoon, everyone. Thanks so much for giving me the opportunity to talk with you about our self-management and transition program. I've been the IBD social worker at Cincinnati Children's for 7 years and have been the transition coordinator role for 6 years and working with patients on self-management skills and ultimately successful transfer to adult GI care when they get to that point.
I'm giving you the mouse right now. You should be able to control it now.
I think I can, but I'm not sure how to go from one slide to the next.
So you can do page down on your screen. You should be able to do page down on your keyboard, or just click on it with your mouse. Just click on the slide.
I'm doing both of those, and neither's working.
Oh no!
It's I see keyboard and mouse is not bolded on my.
Try it again. Try it again. There you go. There you go. You got it.
Yeah. All right. So let's get started. So, and knowing that a key driver to successful IBD care is self-management and adherence. When talk began in 2011 for some kind of self-management and transition of care program, we identified the need to ensure education and preparation for our older teenage and young adult patients for successful transition and transfer to adult care, which we know is crucial for long-term healthy outcomes. And we ended up using our ICN registry in identifying 400 plus patients who were 16 and older, yet we did not have any tools for measuring the patient's ability to manage their care once they turned 18, and we had no formal process for transferring their care to an adult doctor when that time came. So in using the QI approach to address this gap in our program, we used the PDSA model for improvement. And so I'm going to go through the different steps of what this program has looked like over the last 6 years from start to finish. So our aim was to identify patient, provider, and system level changes which can develop and improve a successful self-management and transition of care program to lead to improved IBD outcomes. And where we started was knowing, since we had no measurement tool for assessing patient readiness, we looked at a couple different measurement tools and finally decided to use the Transition Readiness Assessment Questionnaire, which is a generic tool, meaning that the questions on there are not IBD specific, but we've been able to successfully use it, and it is the only validated assessment tool used within Cincinnati Children's. And so our first PDSA was to test this with patients over the age of 21 to see how it worked within the clinic flow. And then once we determined that it was a successful tool in determining where the patient was at in terms of self-management mastery, we decided to have our patients do that assessment every 6 months so we could track their progress from one visit to the next. In identifying which patients would be coming to clinic, we use pre-clinic planning every week, and it really is helpful. I get a list every week of the following week's patients who are scheduled, and it tells me who they're seeing, what day they're coming, what location, and in that pre-clinic planning meeting, we've got the following people who are there: doctors, nurses, our program manager, myself, psychology, and research. And this helps us all collaborate where if I see a patient that I know I need to, I'll let the doctor know and say, hey, I'm going to be seeing them just so you know. Or if I know that, maybe they've had some anxiety or psychosocial issues, I can talk with our psychologist, because we do have a psychologist embedded in our IBD clinics, which is really helpful. So I wanted to make sure that I wasn't biting off more than I can chew right at the beginning, so I started small. I got a list from our registry of all the patients 21 and over and focused only on those during pre-clinic planning every week. And then once I kind of got a handle on it and figured out some of the different tools that we were going to start using for self-management education, we lowered the age that I was going to start focusing on patients 18 and older. And then we went to looking at all of the patients 16 and older with our IBD-specific doctors. And then I spread it to the rest of our doctors. And one thing I encountered with spreading it to the non-IBD providers was some of the other doctors did not truly understand transition of care or its importance, and their nurses, where I would be talking with them and say, I want to see your patient to talk with them about transition, and the doctor would say back, well, this patient's only 16. They're not going to transition till they're in their 20s. And so explaining to them the difference between transition of care preparation versus ultimate transfer of care in the future. So we addressed that by taking the first 66 patients who completed the transition readiness assessment and looked at their assessment scores. What we decided our benchmark for mastery was 90 out of 100 in terms of their score on the track. Out of those 66 patients, the average track score was 72. So our patients were close to failing. And out of the 66 total, only 4 patients were hitting that benchmark for 90%. So I put it together, and doctors sometimes see better in terms of data and graphs, and showed them that we were failing our patients by not preparing them, and that it was an important piece of ensuring that they would be successfully able to navigate an adult doctor's office and continue to be healthy. These are the tools that we use as of right now. Over the last 6 years, we've implemented them at different time frames. When the patient turns 14, I send them what we call the birthday letter, which explains transition of care, self-management education, and what's going to happen when they come to the clinic visit. They're going to meet with me. They're going to do a self-management assessment. They're going to get the self-management handbook. We use the NASPGHAN self-management skill checklist, and we use self-management problem-solving scenarios where I kind of liken it to math word problems, but it's IBD self-management in the real world. So it's not so much of them always just doing this track assessment and checking off boxes, but it's them, as an example, in terms of using the pharmacy. One of the scenarios says, it's Wednesday, you take 1 pill a day, you have 3 pills left, but you know you have to work this weekend when the pharmacy is open. So what are you going to do today to make sure that you're not going to be without your medicine? And I think sometimes that helps them think differently in terms of real life managing a chronic illness. And I created a packet for juniors and seniors in high school to think about what's this going to look like when I'm off at college, if I'm living on my own for the first time on campus and I need to start learning how to manage my care. Do I need to find a new pharmacy? Do I need to find a new infusion center that's closer to campus? Do I need to start keeping my own calendar for infusions because I'm not living at home and my mom's not doing it for me anymore? And then we have a handout for IBDU website, which has a lot of great resources for young adults living independently with IBD. And I've mentioned a couple of the different self-management skills, and this is just a quick look at some of them. We talked about adherence, strategies if needed, using the pharmacies, how to schedule appointments, then keeping a calendar for those appointments. I make sure to talk with the patient about saving their nurse's phone number in their cell phone so that they know what to do if they don't feel well. I wanted to give you a kind of what I call a perfect Patty model patient look at the self-management program. Now, I'll preface this by saying we know that no patient is perfect and there are always bumps in the road, but to give you an idea of how we have framed all of this self-management education, this is what we've got. So at 14, they get the birthday letter, they do the track assessment, they get the self-management checklist, they get the self-management handbook, and then we start talking about what skills they want to start working on. So we look at their assessment and say, okay, well, you haven't learned how to use the pharmacy, so maybe that's the best place to start. If they're only on Remicade, perhaps them starting to keep a calendar to know when their infusions are is a good place to start. From the ages of 14 to 17, that's pretty much how it goes, is that they do the assessments on the track every 6 months. They come to clinic. I meet with them, and we see how they're doing. If they're accomplishing goals, we set new ones. If there are other things going on, we address those as they come up, adherence issues, psychosocial issues, etc. From 17 to 18, we start talking about what do they want to do after high school. If they're making college visits, if they're planning to move, if they're just going to get a job and they're going to start living on their own, how can we start planning for that? And between 18 to 22, a lot of times there's sometimes not much left for me to do because hopefully as they've transitioned onto college or living independently, they've had a lot of practice in managing their care and hopefully they've mastered all of the self-management milestones. But I do give them the problem-solving scenarios, the IBDU handout, just to give them different aspects of looking at what living independently with a chronic illness looks like. And then we get to when most of the time, by the time they're finished with college, we start talking about transferring to an adult doctor. When we began the self-management program, we knew that a key piece to making it successful would be the collaboration with community adult providers. So we have a number of practices that we work with here in Cincinnati, and this really does help the program in a number of ways. It prevents bounce backs. So if the patient gets to the new center, but then they end up coming back to our ED, it ensures direct communication regarding specific patient needs that maybe the doctor can't get from the medical records on paper. And it also provides opportunities for research on long-term transition and health outcomes for adult IBD patients. We've been trying to get this started, so I think it's a great opportunity to know how do our patients do once they leave us. and go on to adult care. In trying to study how we've been doing thus far, I wanted to give you a couple different measurements, metrics. So far, in the last few years, we've been able to engage 93% of our 14 and older patients in the self-management program. The total number of patients we transferred so far is 182, and out of that number, we've only had 3 bounce back. And those were due to insurance issues, not so much what we as a center didn't do to prepare them. And the number of our IBD patients who are 22 and older, we have just 17, and that's out of about 750 patients. We were also able to look at are these patients' self-management assessment scores increasing as a result of meeting with myself, the social worker. So we wanted to look at track scores before they saw me and then track scores after they saw me to see if their assessment score increased and also to see if the number of skills mastered would increase. And we were able to demonstrate that. And so you can see their track scores increased from 68 to 74, and their number of skills mastered increased from 7 to 9. So I know that Peter Margolis talked about, you know, what we want for our patients is sustained remission. That's the ultimate goal, because if we hope that if our patients are taking better care of themselves, they're able to stay in remission longer, which will both improve health outcomes and lower health care costs. So the doctor I work with made this run chart. I can't take credit for it, but this is within ICN, the percentage of patients in sustained remission, and I've highlighted the different elements of our self-management program when they were added, and you can see a bump in the sustained remission rates, which I think is an excellent illustration of how important self-management is. So this is what our current program looks like, just to tie things up. Pre-clinic planning, the use of the track on an electronic tablet for patients 14 and older. We use ongoing goal setting for self-management skills. I see the patients about every 3 to 6 months. We do use telemedicine to help engage those patients seen at satellite clinics, and we have the established process for transferring patients to adult GI care. And our next steps are working to expand telemedicine to all our additional satellite clinics so we can reach more patients. And when I presented this in person in Dallas at ICN, another clinician gave me the idea of what they do in their clinic, which is to start disease education at 12 and then start maybe talking about self-management at 14. So that might be something new that I'm going to try here in the next couple months and see what it looks like. And we also, as I said, want to utilize our collaboration with the community adult practices for research on long-term outcomes for our transfer patients. And that's it.
Excellent. Thank you.
Time for questions.
We do. Thank you so much, Erin. I would love to give folks a second to see if we have any questions that people want to type in the chat box or in the question box. And additionally, while you're reflecting on any questions, I would love to have any parents or patients on the call who are nearing transition age or who have already gone through transition. If there are things that you remember that your clinical team did that really worked well to help you prepare yourself for transition, if you wouldn't mind typing a line or so about what they did, just to get some discussion going.
Yes,
so let's
absolutely.
give it.
Always down for new ideas.
Because I know we have a lot of folks on this call that may have patients are sort of in that age range, so it'll be interesting to see what people share.
And I did want to add the tools that I talked about that we use in clinic, they were put on the ICN page. I'm blanking on the the name of it right now. But they were made available. The ICN exchange. That's what I was saying.
Yeah, that's right. Yeah, the tools that Erin mentioned, and actually that many of the folks on today's call are mentioning, are shared on our Improve Care Now online community comments. And so folks who are part of an Improve Care Now center or a parent or patient working with an Improve Care Now center have access to them that way. But if there are other tools that folks that may not already be connected with the center hear about today, that's one of the things you can share in the chat box or question box if you'd like us to follow up and share them with you. So let's just give it about 30 more seconds to see if there are any questions or comments, and then we will move on. I really like how Erin talked about, taking the big picture of the Improve Care Now key driver diagram, namely those two very important areas of self-management support and psychosocial support, and helped us understand how applying quality improvement at the local level can really help move activities in those areas. And in particular, I'm going to go back to your chart. One of the things that those of you who already work closely with the network know is that there's really no, stories are incredibly important, and hearing kind of the narratives, hearing the details of how things happened, help other people replicate them and do similar things and adapt things to their settings. But when you want to see what difference it has really made to patient outcomes, there's no good replacement for a good chart. And in particular, I really like how you annotated. You gave us narrative and data on this chart to help us understand the impact of the different things you've done. So thank you so much, Erin, for that great presentation. I did get one question. There's one question in the chat box from a parent who's asking if there's ever a situation where the adult and pediatric provider are in the same office visit. So I do not know of that being particularly common. I can tell you that we have one center who has recently started testing. I'm not sure if it's monthly or less frequent right now, but they're having an adult provider come to a group clinic visit for those patients who are nearing transition age to at least have the discussion about what can be expected from adult care. But certainly if anybody knows of situations where adult and peds providers are in the same office visit, go ahead and type that in the chat box. That's actually a great question.
I can tell you that we did try that at a certain point. It was before I was involved, but unfortunately what we found was having the adult doctor come to clinic, there were times that the patient would not show up or cancel, and that it ended up not being a good use of the adult doctor's time, and they discontinued it. But it would be great if we could.
Yeah, that was a great question. Thank you for sharing that. So thank you so much, Erin. Thank you for helping us kind of drill down to the center level and understand how the quality improvement methodology can really make a difference locally.